My name's Dr. Marwan Dawoud. I'm a sport and exercise medicine doctor. I work across elite sports. So I've worked in Premiership football, Premiership rugby, Super League, worked at club level, national level with England Rugby League. I also work on the NHS, so I work in an NHS Foundation Trust. I'm also Clinical Director for Connect Health, which is an independent provider for community healthcare services and specifically community musculoskeletal services. So I've worked in healthcare for a long time. I've worked in general practice, in private practice, in sport, and all of them use different services, different healthcare records. The one thing that you tend to not to get is them communicating together, and that's across community and also in secondary care. So often hospitals find that they've got about 10 different systems to work one patient's record. So sport's really interesting in that the type of record that you have is dependent on so many different factors. So some sports, for example, like rugby union, have a centralised electronic patient record, which the RFU essentially pay for all the clubs to use. So it's one system and it's all kept quite neatly together. In rugby league, for example, they don't do that. So each club, so for example, when I was head of medical at Leeds Rhinos, we would have to get our own system and fund it as a club ourselves. And another club, Wigan Warriors, Castleford, or a different club might have a different system or a different software, and these systems don't communicate together. From my experience working at England level, when you're on England camp, obviously you're borrowing the player and trying to make sure that you look after them, and you're reliant on their history. So are they carrying a knock? Have they got a past history of a heart condition that you need to be aware of? Having access to their medical record, full access, would really help when you really need to make snapshot decisions. But unfortunately, at a lot of national level arenas, you don't have that access. You either have paper notes or it's a phone call to the head of medical or the physio. So in rugby league, you are quite limited. In rugby union, for example, you do have access. So it is variable depending on the sport. And I think that variability, when you're looking across sport, does cause issues, because ultimately what you'd really love to have would be have access. Whatever sport you work in, whatever athlete you're with, there is one record. Because even just practically, all these records, they look different. So getting used to how to work them, you have to get your head around it. Rugby league have an injury audit system, and their system was a different system, and they didn't communicate. So what the physios were having to do was to manually go through every player's record, fill out a form to say this is what injuries they have, and then submit it onto the rugby league system, which was a different one. So what we ended up doing to try to save time is move on to that system. That happened, but obviously migrating the data from one system to another causes issues. These things, just like anything, they're not seamless and there are often teething issues. So making sure that all the records were put across did cause us a lot of time and effort, which we could have saved, to be looking after our players. So I sit in a bit of a unique position because I work in sport as a club doctor, but I also sit on the other side of it as a specialist, and I see players who are sent to me from other clubs. So I do see things from both angles. So when you're a club doctor and you're asking for a scan or you want a consultant opinion, the information you give is usually on letter. What we know from the best thing for any person, player, patient, is that the person who's looking after them has full access to everything. So for example, you see a player with a knee injury and they've got a ligament injury, ligament tear. If you don't know that actually a year ago they had a ligament tear and this is what the scan looked like and this is specifically the site of where it was, and actually this is a re-tear of a previous site, that information can make a big difference to your decision making and your advice. And not to say that that doesn't exist. So you might have a verbal handover in the letter, it might say there was a tear X, Y and Z, but getting someone else's opinion on what happened is quite different to you seeing the record. So I remember 15 years ago when I first started working in sport, I made a little A4 printout, which was a handover page, which had details, injury, and then what I've done and my signature of drugs I've given. And I did that at the time, that if a player, we had to send A&E to hospital, we would be able to give that to the player or to the ambulance, and they would be able to give that to the doctor or nurse who's going to see them on the other end of it. 15 years later, that's still what I'm doing. And the fact that there isn't something electronic that could be that I could be able to give them something instant and I know that they're going to get it, because I think half the time in my experience, a piece of paper gets lost on the way, and the information that you want to portray to the receiving doctor is lost. So there's so many different areas in which that could be improved, and as I say, 15 years later, you really would think with the advances in technology that there would be an electronic way of instantly communicating with A&E, for example. So just continue talking about the example of an A&E doctor receiving a referral of a patient that I've sent in. They're going to sort of sometimes going in blind, even simple things like knowing what drug allergies that player might have, they might not have access to, which is quite scary. If a player is unconscious or needs emergency surgery, things like that, which you'd expect to be able to have access to, they might do whatever treatment needs to be done, and that communication back sometimes is either really delayed, so you might be talking like you might find out a month later what's actually happened, might be reliant on the actual player themselves telling you, which isn't always the best way, or might never happen. So that feedback mechanism, which does exist in more mainstream healthcare, but has got room for improvement, pretty much doesn't exist in the sports world. One of my roles is lead doctor for the England partially sighted football team, and there are lots of reasons why the players can become partially sighted. In terms of the way it works at England and with the FAs, there's lots of ophthalmology screening, so eye screening that we do with the players, looking at the back of their eye, doing special tests for vision, and we get specialists, we get ophthalmologists who are consultants in that area, and they do lots and lots of tests and we get lots of information, and that goes on the FA medical record. In terms of communication with the patient's GP in more mainstream care, these people are kind of normal people who might trip up or get sick and get appendicitis and go to the GP. That communication link, again, is something that is missing. So on one hand, you've got all this really great amount of medical information that we hold from a sport perspective, but the GP might not fully be aware of it all. But vice versa, the communication from the GP, again, we do medical screening. So once a year, we would go through the health of all the athletes, ask them questions, do examinations, and do our own screening. That on its own is good, but what would make it better would be having that information on the backdrop of all the GP information. So all the times their immunisations they've had, for example, times they've been sick over the past, have they had the tonsils removed? Simple things that you would help you make informed decisions as a medical practitioner. I give a really pertinent example. I saw 18 months ago an 18-year-old kid who had back pain going down his leg, had been seeing his GP and had some blood tests, which I didn't have access to. They came to see me and I was worried about whether there might be a nerve problem in his back and things, and had asked to see the blood test. It took several days for the patient to speak to the GP, to then get a copy and then send me a copy of the blood test results. When I saw a copy of the blood test results, it completely changed my management and my worry, and this person ended up having cancer. So it really can make a big difference having timely information to decision making. I'm not surprised at AB3's data that 90% of doctors don't pass on information about a player when they're transferring to another club. Sitting on both sides of the fence, both sides of working in sport, receiving and then players leaving, it's an area which sometimes you really are in the dark. Often you'll get the information that they want to tell you, which just doesn't seem right. That either a club or a player can dictate what information you know, because it does make a big difference. It can make a difference about whether you want to sign the player, about how much investment or resource they will need to look after them. What I really like about AB3 is it just flips the model on its head. Normally, a club or an organisation has a medical electronic record system that they dictate what happens. What I really like about AB3 is it's the player's record, and the player owns that record, and that goes with the player. So it really empowers the player, which I think is revolutionary. Often in sport, players have majority of their healthcare provided by that club, by the club doctor. They often don't access the NHS and they don't access the GP because the majority of their health is covered by the sport. So when they come to retire, you can imagine the amount and the cumulative amount of kind of player records and information that's been held by a club is vast. It's pretty much the the club will know everything about them. So when they come to retire, and suddenly they're out there in the big bad world and they have to then access more mainstream services, sometimes that information it is not passed on fully, and even with the best will in the world. So the way I've tried to do things is to provide summary kind of letters and things with the GP to kind of summarise the main issues that player might be having on retirement, so that the GP knows what they can then start to work on, if anything. But ultimately, that's, even with the best will in the world, that's not the same as having full access. So every heart scan, every MRI scan, every blood test, every medical that they have. For example, they have a mental health issue. So they've been struggling with anxiety and depression for the past 10 years and have been accessing a sports psychiatrist and a counsellor from sports. And then they go to see their GP. The GP is going to be on the back foot with it, with not having any of this information. So it's about streamlining care, it's about joining up care, and it's ultimately about making things best for the player. So just like the general public, athletes can also get chronic diseases. So asthma, diabetes, heart conditions, COVID, long COVID, mental health. All these issues require careful monitoring, they require sometimes blood tests, they require review, and that process would have been happening with the club. And again, moving on to when the player leaves the elite sports environment, that information, that knowledge, that experience needs to be passed on to the NHS, and we need to do better. Having used AB3, what I like about it is it's simple to use, really easy, doesn't take time, you can put in what you need, where you need it, and its information's there quickly, and it's accessible, and ultimately it's been created by a doctor, it's done by a healthcare professional for healthcare professionals, so someone who knows what we want to know. It's just really simple and easy, for a player to find all their information. So whether it's medical screening, whether it's scans they've had, blood tests, it's all there in one place. The app splits everything into body parts, so it's very clear for the player to know where they can find things, whether that's medical letters, medical screening, blood test results, and so on. One of the cool things about it is it's the kind of function where the receiving doctor or clinician, so for example that A&E consultant who sees the player who's got a broken leg, can input directly onto the app, and that can be available on the dashboard for me straight away, and that's something that's unique. The app's got a feature where you can essentially directly communicate with that player. So for example, they've had a blood test and you want to repeat it again in a month's time, and in that month's time you can send a push notification. We all know in today's age that the internet just means that information is just there at your fingertips, and players, like everybody else, will just Google everything. So if you tell them they've got X condition, they'll Google it and they might find 100 different opinions which tell them 100 different things to do, and they get worried. More so than just being worried, they might start doing things that are not appropriate or things that are not in line with the advice you'd give. One of the things that the app does to mitigate this is it has resource section that you can tailor that are trusted, tested, and particularly advised by yourself to the player can access. AB3 empowers the athlete, merges a record, and revolutionises care in sport.